This is Radio Health Journal. I'm Nancy Benson. This week, bacteria in your Super Bowl snacks.
If someone's double dipping, you're actually kissing each person in the room because they're pretty much spreading their saliva to the dip.
Snacks, double dipping, and the 5-second rule when Radio Health Journal returns.
I'm Reed Pence, the producer and host of Radio Health Journal. If you like listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
This was an organization that took forgers out of jail to work for the organization because they could be so effective.
The unconventional methods of the Office of Strategic Services during World War II. Then,
I can tell you about Sharpie Gate, and I can tell you about Moisture Gate, and I can tell you about all the ups and downs of the Mueller investigation.
But what does all of this knowledge add to the world? I'm Marty Peterson.
And I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoint.
Listen to Radio Health Journal and Viewpoints on your favorite radio station. And subscribe and listen anytime on Apple Podcasts, Google Play, and Spotify. Also, follow us on Instagram and Twitter at Radio Health Journal.
The Super Bowl is the nation's #1 reason to throw a party, with millions of us digging into the drinks and snacks, the chips, and the dip. But there's an etiquette to eating those foods, built on our conceptions of sanitation. For example, what do you do when you've dipped your chip, taken a bite, and still have half a chip left? Do you dip it again and perhaps contaminate the dip? Do you turn the chip around and dip the other end? Or is double dipping really not that big a deal?
The recommendation is certainly during cold and flu season from the CDC is you cover your mouth when you sneeze. Fact of the matter is that that's how colds and flu spread through the population, is you're touching something or someone sneezes and touches a doorknob. It's not really a mystery how it gets from one person to another, and that's primarily through the bacteria in the oral cavity. So this would be just one other way that it might be transferred.
That's Dr. Paul Dawson, professor of food, nutrition, and packaging science at Clemson University. And yes, he's done controlled studies on just how much bacteria can be spread by double dipping.
The analogy we use is kind of crude way to say it, but if someone's double dipping, you're actually kissing each person in the room. They're pretty much spreading their saliva to the dip. So people kiss each other and they get along fine, but it is a way that germs are spread.
Dawson and his team originally didn't think that double dipping would spread very many germs. After all, most of the chip or cracker that's contacted by your mouth stays in your mouth. So they initially ran an experiment using sterile water as a dip.
We found about 1,000 bacteria in the solution that had been exposed to chips that had been bit versus below detection on the ones that had not been bitten. So 1,000 to 1 there. It's about 1,000 bacteria per milliliter. And again, to give a kind of a ballpark figure of what a milliliter would be, if you kind of estimate that if you pulled out a chip of salsa and on the chip, you'd probably have 20 to 30 milliliters of salsa, so about 20, 30 times that. So, potentially there could be quite a lot. We did a controlled study of 20 mils of water, dipping a chip in that, and then measuring the amount of bacteria transferred after 3 times. And we found about 1,000 bacteria in that first study. So we were surprised at that, actually.
Dawson's team then considered different kinds of dip and whether that makes a difference. Salsa dips, for example, are more acidic than cheese dips, and bacteria don't like acid. Once again, the researchers initially simulated double dipping under controlled conditions.
So we took the sterile water again and adjusted the pH levels to 4, 5, and 6, and want to compare those different pH levels, thinking that maybe the lower pH, the more acidic, would have an inhibitory effect on the bacteria that was transferred, maybe get rid of it right away. Actually, we found that there was an effect. We actually held the solution there 2 hours, kind of simulating what might happen at a party, and it dropped the levels down, still pretty high in the hundreds per milliliter, but there was a acidity effect in the lowest pH, still very high levels.
Those results proved to Dawson that double dipping can indeed be trouble. So it was time to move on to real food to see if the results held.
We found that there were, again, about 500 to 1,000 more bacteria per milliliter initially than when you didn't bite. Interesting thing was, though, that salsa, we didn't expect this because we just used water before. The salsa actually had a higher transfer rate to the dip than did the chocolate and cheese initially. And thinking about it, kind of obvious that salsa is much thinner, a lower viscosity. So when you dip it in the dipping solution, more of that salsa falls back into the common bowl or remains there than would be with the cheese, which would adhere greater to the chip. Numbers were about 5 times higher in the salsa than they were in the cheese.
However, the acid present in salsa dip kills more bacteria over time than in a cheese dip, so within about 2 hours, the dips end up about equal in bacteria content. But double dipping is only one of the important snack food contamination questions Dawson and his team have investigated. They've also probed the validity of the well-known 5-second rule, which says any food dropped on the floor is still clean enough to eat if you pick it up within 5 seconds. Reportedly, 70% of women and nearly 60% of men adhere to the 5-second rule. But where did the rule come from in the first place? Dawson says the most likely place may be an extremely popular TV cooking show.
Julia Child made a comment, I think, on one show, then it was misquoted, but in general, she made a comment that if she dropped something in the kitchen and picked it up, if nobody sees it, it's going to be okay. So I think that's kind of where it may have started. We're not really sure.
Dawson investigated the 5-second rule, again with controlled studies, counting bacteria transferred to food after 5 seconds, 30 seconds, and 1 minute of contact with the floor.
So we inoculated 3 different surfaces, tile, wood laminate floor, and actually a Berber carpet, and found in all cases that the bacteria was picked up immediately. Bacteria is faster than the human hand, I guess, is the answer to that. Like the double dipping, we found some interesting differences in numbers and amount of bacteria picked up due to the surfaces. Carpet actually was much lower based on what we inoculated than were tile and wood. And common sense would tell you that if you have a bacteria on the surface that's kind of absorbent, somewhat like a carpet, that it's not going to be as much of the surface area exposed with the bacteria. And on the other hand, the bacteria probably would live longer on a carpet than it would on a tile, or survive better because it's kind of protected and there's probably moisture there.
Dawson's group also came up with another scary finding. Once a floor is contaminated, it stays that way for a long, long time.
Even salmonella, things that are just bacterial cells, survive very long on surfaces. We inoculated tile and left it at really room conditions, temperature, as well as humidity. And the tile feels completely dry. There's no appearance. It's not dirty. But we were recovering bacteria from that tile 28 days later. So that was quite surprising. You think that once it dries out, the bacteria will die. So that was kind of a eye-opening reminder that, the cleaning surfaces after you've had something there like raw food, chicken or whatever, is very important.
However, cleaning in the kitchen isn't foolproof, even when you think it is. Labels on disinfectant cleaners can be misleading.
You always hear the use of percent with bacteria, like this kills 99.9% of the bacteria or something of that nature, and that is somewhat of a misleading terminology because bacteria is in such high concentrations. If you have a highly contaminated surface, like you're preparing raw food or you're in a hospital, killing 99.9% is not going to put you in a safety zone. Now, it's not better than anything, but that's kind of a thing when we deal with bacterial contamination, that those percents, until you get out to 99.999, about 4 or 5 nines out there, if it's a highly contaminated surface, then it's misleading sometimes, I guess what I'm trying to say.
So if you drop that chip on the floor, contamination depends a lot more on what's on the floor than how long your chip was there.
Most surfaces are not going to have pathogens on them. So 999 times out of 1,000, there's probably nothing there that would hurt you. But I make the analogy, it's kind of like wearing a seatbelt or not. You can drive your whole life, not have an accident, and seatbelt has no effect. But if there's an accident or if you have bacteria there, the seatbelt or not eating the food is probably going to be a good idea.
It's almost enough to make you avoid the snacks completely. You can find out more about all our guests on our website, radiohealthjournal.org. Our studio producer is Jason Dickey. I'm Nancy Benson.
Radio Health Journal returns in just a moment.
People are living long lives today, but many of them are living more years in poor health. That's why the American Heart Association is setting bold new goals to increase what's called healthy life expectancy from 66 to 68 years in the U.S. and do it by the year 2030. The goals are published in a presidential advisory in the journal Circulation. American Heart Association President Robert Harrington.
We want people to live healthier, longer. Over the next 10 years, we will dedicate every resource in our organization to empower people everywhere to make healthy lifestyle choices, address social and economic barriers to health, and support evidence-based and system-wide approaches to improve overall health and well-being.
Dr. Harrington says to reach the goals, many diverse groups, from local neighborhoods to global governments, will need to work collaboratively with creativity and innovation. Find out more at heart.org.
And that's Radio Health Journal for this week. Radio Health Journal is a production of MediaTrax Communications. Follow us on Twitter, Facebook, and Instagram to learn more. And check Apple Podcasts, Google Play, and Spotify for a library of past programs. Plus, you'll always find previous segments and information about our guests at radiohealthjournal.org. Join us again next week for another edition of Radio Health Journal.
Coming up next week on Radio Health Journal.
It can be beneficial for the individual. It can actually give them strength and power to hang in there with their spouse.
A moral question. Easing the grief of a spouse's advanced Alzheimer's by starting a new relationship.
Then needle phobia. A surprising number of people avoid doctors completely because of it.
I knew that if she reached up to pull that cord to indicate we're getting off the bus in front of that red brick building, that I was going to get a shot and I would go berserk.
All that and more on Radio Health Journal